please tell us about the Notify trial and plans for the Notify trial.
Well, the Notified trial that we're planning, it's not yet funded, is to look at the effect of notifying patients who have been screened for lung cancer with a CT scan, who do not have any atherosclerotic disease that is known, and who are not on lipid-lowering therapy, and notifying them and their clinicians about the presence of coronary calcium on a previous scan that they've had. And we're going to compare the effect of that notification with a guideline reminder to clinicians.
And how will the coronary calcium score be measured?
Good question. So we've developed an AI algorithm that is able to look at a non-gated chest CT, so a low-dose CT scan done for lung cancer screening. And this algorithm can quantify the amount of calcium. We're going to select people who have a calcium score of 100 or greater, so that puts them at increased risk for having a heart attack or a stroke or death.
And so how did you get interested in this area? How did you think about using lung screening to look at coronary artery disease and outcomes?
So as a preventive cardiologist, I order a lot of coronary artery calcium scans. And I realized that before I order such a scan, that it made sense to review the patient's electronic health record to see if they've had a chest CT done for other reasons at some time in the past. And if so, I can detect, either by looking at the scan or reading the report, if coronary calcium is present. And if it is, it answers in a binary way, yes, no, if coronary calcium is present. So the idea arose that if we take scans that have already been performed, all of these millions of CT scans that have already been done, the information is there, and we could identify a cohort for a clinical trial based on those CT scans. Now, it has upset me very much that insurance generally does not pay for these scans. And so I really wanted to design a clinical trial that would be able to prove that knowing one's calcium score improves outcomes.
And so what is the ultimate goal for Notify?
Well, number one, it's to prove that if you inform people about a clear and present danger, that they will take action. In other words, they'll talk to their doctors or other clinicians and get started on appropriate preventive interventions. And then I hope that that leads to increasing the proportion of people who are eligible for lung cancer screening to get lung cancer screening, because if you can get it, you'll get a twofer. You'll be screened for coronary disease at the same time you're being screened for lung cancer. If we're able to prove that this leads to better outcomes, again, my hope is that payers will pay for the test, increasing access to everyone who has medical insurance to get a coronary calcium scan that's a covered expense.
Do you think that Notify will change the guidelines?
Well, I think it will change the guidelines for lung cancer screening, because I think it will include screening for coronary artery disease at the same time. And my hope is that it will also lead to changes in cardiology guidelines for who should get screened. And I think that it will help move the field in the direction of using anatomic information to identify the people who are at high risk. Because unfortunately, using risk factors alone is not nearly as good at predicting events. The reason why we're choosing patients with who have undergone lung cancer screening for the proposed trial is that people who are eligible for lung cancer screening, as currently defined, are also at very high risk for coronary disease. In fact, as you know, in the National Lung Screening Trial, the number one cause of death was not lung cancer, but it was coronary disease.